Here we're going to look at the plaster cast along with its uses. So firstly, to start off with questions, what is the hip spica cast? What is the hip spica cast and where is it used? Second is, what is the riser cast? Third, what is the bachelor cast? So in this video, we'll cover all these answers, and in the end, there is also a bonus section. So first, we look at the Minerva cast. So what is the Minerva cast? It is used in case of the cervical. It is used in case of cervical as well as the upper thoracic spine disease. Then we look at the riser cast. So the riser cast, it is used in case of the scoliosis. And beyond this, there is also the turnbuckle. Turnbuckle cast. Turnbuckle cast is also used in the scoliosis. Now moving on to the shoulder spica cast. So the shoulder spica cast is used in case of the, as the name suggests, shoulder immobilization. After this, we go on to the U-slab. The U-slab or the hanging cast. So in the U-slab or the hanging cast, we look at the fracture of the humerus. And then we look at the hip spica. And in case of the hip spica, it is used for the fracture of the femur. Now, moving on, we look at the patella. That is the patella tendon bearing cast. So here it is used in case of the fracture of the tibia. Then we look at the Colles cast. The Colles cast. The Colles cast is also known as the handshake. The hand shaking cast. So this is used in case of the fracture of the lower end of the radius. Next, what we see is the bachelor cast. So what is the bachelor cast? So the bachelor cast is nothing but it can result in the DDH. That is the developmental dysplasia of the hip. Developmental dysplasia of the hip. Then we move on to the glass. The glass holding cast. So what is a glass holding cast? It is used in case of the fracture of the scaphoid. Then we have the Burkhalter cast. So the Burkhalter cast. So the Burkhalter cast is used in case of the metacarpal or phalangeal. So it is used in the metacarpal or the phalangeal fracture. It is used in the metacarpal or the phalangeal fracture. Next, we have the James fracture. We have the James fracture. So the James fracture, it is used in case of the metacarpal as well as the phalangeal fracture. So now we'll be going ahead with answering our questions. So the first question we asked was, where is the hip spica cast used? So the hip spica cast, it is used in the fracture of the femur. Next, the second question we asked was, what is the riser cast? So the riser cast is used in nothing but the scoliosis. The third question is, where is the bachelor cast used? So the bachelor cast was used in the DDH, that is the developmental dysplasia of the hip. So now we move on to the bonus questions which can be answered in the comments. So the bonus question, you can answer them in the comments. So the first question is, where is the glass holding? The glass holding cast, what is the use? The second question is the James slab. Where is the James slab used? Next, the last question is, where is the Burkhalter cast used? So these questions, you can answer it in the comments.